Hello everyone, my name is Dr. Akosua and I make informational videos for pre-dental students, dental students, and new dentists to help with their journey to dentistry. Today I'm going to be talking about 5 red flags to look out for in your dental associate contract. If you're interested, please stay tuned. I'll be honest, the first dental contract I reviewed confused me. It was so much longer than I expected and it had so much legal language that I didn't quite understand. I found myself on Google just trying to find the words and the phrases that I didn't quite understand. So if this is your first contract that you're looking at and you're confused, you're not alone. It's typically normal. Before I start, let me put a disclaimer out there. This video is not legal advice and I'm not a lawyer. This is more for educational entertainment. So with everything I say, please seek your own legal counsel. And if you have a lawyer or someone else you can talk to in the legal world, please also seek their advice for your specific dental contract. For any dental contract that you're seriously reviewing, I highly recommend that you have a lawyer look it over, especially a lawyer that looks at dental contracts to look it over. It might seem like an expensive service in the beginning, but this can actually save you tons of money in the future, tons of headache. You don't want to sign a contract that you haven't had a dental specific lawyer review, especially if this is your first contract. Okay, let's get started with the red flags to look out for in your dental associate contract. Number 1 is an outrageous non-compete clause. A non-compete clause is the part of the contract that talks about the mile radius around the office for which you cannot practice in another office while you're working there, or even for sometimes a couple years after you've left the office. It'll read something like this. Following a 90-day grace period during the term of his or her agreement, and for a period of 2 years following termination of his or her agreement, employees shall not, without full disclosure to the employer and employer's prior written consent, engage in the practice of dentistry within a 15-mile radius of the office of the business currently located at X, or any substitute or additional office locations other than in connection with performance of his or her duties pursuant to his or her agreement. It is completely normal to have a non-compete clause. This one even has a grace period of 90 days. The clause is mainly to protect the office so that once you leave their practice, you don't open a practice next door and basically poach all their patients. The problem is not that there is a non-compete clause. The red flag here is a non-compete clause that has an extremely large radius. So if you're working in a city and you have several offices that are close to each other, you have to think about this, because if you decide to leave your current practice and they had a non-compete radius that was really wide, that covers a lot of the other practices in the area, then you've kind of put yourself out of being able to work in any of those practices. So if you work in an area that has a lot of dental practices, you want to make sure that that radius is relatively small. If you work in a rural area and all the offices are kind of spread out, then you're probably going to see a larger radius in your contract and you don't want to freak out. However, you want to check out what the radius covers, right? So if you happen to live within that radius, you want to make sure that the contract you're signing doesn't kick you out of being able to drive to a relatively close distance in the next job that you're looking at. A non-compete clause should be reasonable within the geographic location that you are and should really not be longer than 2 years after you've left, because anything after that is difficult and you should really consider that before you sign the contract, or just negotiate to have that be lowered. As always, please have a lawyer look over this contract for you. If you're going to be new to the area, you want to make sure you do a lot of research about what's in that area. If you have a lawyer that's local, they might be really able to help you out. Number 2 red flag is an extreme termination clause. A termination clause discusses the terms for which you can leave the office and typically will include the number of days notice you need to give the office before you can leave. It'll read something like this. Either party may at any time cancel and terminate his or her agreement on an at-will basis with or without good cause or good reason by giving 60 days prior notice to the other party. A termination clause is normal. The office doesn't want to have to deal with patient abandonment. They don't want doctors giving only a 2 weeks notice, because most of the time you're probably in the middle of treatment. So you'll see termination clauses between 30 and 90 days, which is typically normal because within that time period, you can complete all the work that you've started. So if you've prepped some crowns, you should be able to deliver them. If you've started some dental work, you should be able to complete that. It's a reasonable amount of time. The red flag here, I think, is anything over 90 days. That's 3 months. If you are looking for another job and you go and interview, most of the time they will ask you, when can you start? And you can't start until your termination clause is complete. Probably by that time you haven't even put in your notice that you want to leave. So if you're going to start anything after 3 months, unless that office is being very patient, most offices can't wait anything longer than 3 months for you. So you have to keep that in mind. If you sign a termination clause that's for 6 months, an office that you're trying to work in may not be able to wait for you for 6 months. That's why I think 90 days is generally ideal. Some contracts will fine you a certain amount per day if you don't uphold the termination clause. And that part of the contract will read something like this. Employer may provide pay in lieu of notice, calculated based upon their average salary of employee during the 6-month period prior to termination. If it's a 60-day termination clause and you gave the office 30 days, some offices will charge you for the remaining 30 days. They will calculate how much you've been making per day for however long you've been there, whatever that average is, and multiply it by 30 days. So you're basically going to be fined for not upholding the clause. This is to deter people from just, giving any type of short notice. Ultimately, plan accordingly so you can quit properly and not leave your patient's treatment plan hanging. And also ensure that the clause that you're signing is not too long of a notice time. As always, consult a lawyer. Number 3 is no daily minimum guarantee. A daily minimum guarantee is an agreed upon amount that your employer pays you per day, no matter what happens to the schedule. As a new associate, this is really important because you don't have much control of what's placed on your schedule on day 1 or even by month 1. If you're not a salaried employee and you're being paid by percentage of your production or percentage of your collection, then the type of procedures that you're doing per day matters for your pay. So the red flag here is not having any daily minimum guarantee from day 1 when you start. An employer will say in the contract, employee shall receive as compensation a base salary of X dollars per day or an amount equal to X percent, which usually ranges from 25% upward, of all gross revenue collected by the employer, whichever is greater. A daily minimum guarantee incentivizes the employer to fill your schedule adequately with procedures that will allow you to make more than just their minimum per day. It is in the best interest of the employer to fill your schedule properly because even if you make $1 that day because nobody showed up, they still have to pay you that minimum that you've agreed on. This also incentivizes the employee because you want to be able to work hard so you're not just making that minimum per day. As a new employee, you need some time to be able to build up your patient base, and that's why this minimum guarantee is important for a period of time when you start working at a new place. Some offices will give you this minimum for your first 3 to 6 months, and then after that they will pay you based solely on either percentage of your production or percentage of your collection. If that's the case, you want to make sure that you're looking at their current doctor's schedule to see what their average doctors are doing. Obviously, if you're a new doctor, you might not be as quick or as efficient as those doctors, but at least you have a general sense of what your opportunity here is. If the current doctors are typically falling under the minimum, most likely nothing's going to change for you. Also pay attention to what procedures are on the new doctor's schedule. When you first come out, you might not be too efficient with molar endo, implants, and those type of procedures. So if the current doctors are doing that, and you're not going to be doing that as much, you have to advise yourself to make sure that you're not comparing yourself equally to them. As always, consult a lawyer. The 4th red flag is any contract where you end up owing the office because you didn't hit their monthly production target goal. I understand that an office is a business and they have, some places may have production goals and all, but to put that pressure on the employee is a lot. Unless you like that type of competition and you're all up for that type of environment, then I would try to stay away from a contract like this. In my opinion, such contracts can encourage unethical dentistry. Not all the time, but if you're in an office where, your first month in, you didn't make their production goal and so you owe them, 2nd month, same, 3rd month, same. By the 4th month, all of a sudden, you might find yourself overdiagnosing and possibly overtreating in dentistry, which is not a good thing. You do not need that type of pressure, especially as a new doc who's still trying to figure out themselves. If the clinic has enough patients, you should be able to treat enough people ethically to be able to make what you need. I think if you have a clause like this, first of all, reconsider. But if you don't have any other options, again, make sure to go to the office and see what their current schedule for their doctors looks like, and see if their doctors are able to hit this minimum target. Maybe it's a really, really low target and it's achievable, which then why is it there? But if it's there and the doctors don't seem to have any issue, sure, go ahead if that's something that you think is possible for you. You just have to be able to review all those options, because you don't want to find yourself in a situation where you owe the office money every month. As always, please have a lawyer look over this contract and discuss with them. You know, it might have a clause like this, but it might still work for you. Just make sure that you understand all the terms. The next red flag is any employer that is putting pressure on you to sign their contract. If an employer sends you a contract on Monday and they're expecting you to sign the contract by Thursday or Friday of the same week, and they're saying they're going to rescind their offer if you don't sign, you might want to look away. That to me is a red flag. That type of pressure you don't need. Most offices need to understand that you will probably have a lawyer look over this contract, and that takes time. You may still be interviewing with other jobs. You might be comparing contracts. All of this takes time, and they need to understand that you will want to seek legal counsel. Something like your first job contract, something that is going to be paying you a very huge financial decision that can affect you for your life. You want to make sure that you're not signing something that you cannot be responsible for later. So if they're looking for an immediate answer, please, I really advise yourself, talk to your lawyer, because just because it's a large amount of money doesn't necessarily mean it's a good contract. Sometimes they'll have all these shiny numbers in the contract and you might be pushed to sign something like that. Don't sign yourself into something that you cannot handle. When they want such a quick turnover, there might be something in the contract they're hoping that you don't see, and something that they're hoping you don't ask them too many questions about. So as always, contact a lawyer, discuss with your lawyer. It's really, really important that you do that. Okay, thanks for making it to the end of the video. I really appreciate it. If you're new here, thank you so much for watching this video. Subscribe, please leave a like. It helps out the video a lot. If there are any dentists or anybody in the dental field that has any other red flags that other people might also pay attention to, go ahead and put that in the comments section below. Thank you so much for watching this video. I appreciate it, and have a good day. Bye.